Assessing patients with musculoskeletal disorders. What would happen if humans didn't have bones? You'd be floppy like a beanbag. Could you stand up? Forget it. Could you walk? No way. Without bones, you'd be just a puddle of skin and guts on the floor. Bones have two purposes. Some, like the backbone, provide the structure which enables standing erect instead of lying like that puddle on the floor. Other bones protect the delicate and sometimes soft tissues inside the body. The skull, a series of fused bone, acts like a hard protective helmet for the brain. The bones of vertebrae or the spinal column surround the spinal cord, a complex bundle of nerves. Imagine what would happen to the heart and lungs without the protective armor of the rib cage. The skeletal system serves many important functions. It provides a shape and form for our bodies in addition to supporting, protecting, allowing body movement, and producing blood for the body and storing minerals. It is important to remember that the body has other systems that support and enhance these functions as well. The skeleton supports the body against the pull of gravity. The large bones of the lower limb support the trunk when standing. Bones work together with muscles as simple mechanical lever systems to produce body movement. Bones contain more calcium than any other organ. The intercellular matrix of bone contains large amounts of calcium salts, the most important being calcium phosphate. When blood calcium levels decrease below normal, calcium is released from the bone so that there will be adequate supply for metabolic needs. When blood calcium levels are increased, the excess calcium is stored in the bone matrix. The dynamic process of releasing and storing calcium goes on almost continuously. Like other cells in the body, the bone cells rely on blood to keep them alive. Blood brings them food and oxygen and takes away waste. If bones were made of living cells, things like broken toes or arms would never mend. The body makes blood in the bone marrow. Blood contains both red and white blood cells. The red blood cells carry oxygen to muscles, which they need in order to work. The varied lifestyle of everyone demands movement, impossible without muscle. In fact, in man, about 40% of the body mass is striated muscle, making it the most abundant tissue. Striated muscle is so named because of its characteristic cross-striped appearance. Most striated muscle is skeletal muscle, involved in rotation of bones around the joints, and therefore responsible for most of the movements of which we are aware. Other striated muscles move the eyes and serve as valves to check the flow of blood. Cardiac muscle is also striated in appearance, but it differs significantly from other striated muscle in both its structure and its behavior. Still, other muscles called smooth muscles lack the characteristic cross striation, but contain the same contractile proteins. The smooth muscles are important as linings of the gastrointestinal tract that churn and propel food through the tract, as linings of blood vessels that control their diameters, as valves that control the passage of gases and fluids in the body. Isotonic. All lifting exercise require isotonic contractions. This happens when the muscle shortens as it contracts. Eccentric contraction is the opposite of isotonic. The muscle lengthens as it gains tension. These are much less common and not as beneficial as the common isotonic. Isometric. Isometric contraction occurs when there is tension on a muscle but no movement is made, causing the length of the muscle to remain the same. This type of contraction is also referred to as a static contraction. Isokinetic. Similar to the isotonic contraction, the isokinetic contraction causes the muscle to shorten as it gains tension. The difference is isokinetic requires a constant speed over the entire range of motion. Therefore, this type of contraction requires special equipment to exercise properly. A goniometer is used in the medical field to measure the joint's range of motion. It can be helpful in determining if a patient is lacking in mobility due to an injury or how well they are recovering after sustaining an injury. The range of motion of a joint is an angular measure of that joint movement between fully extending and fully flexed position. The measurement of the joint's range of motion is a common method of assessing the joint's recovery after an injury or surgery. Here we have three pictures. The first one is forward flexion of the spine. The middle, lateral flexion of the spine. And the last one on the right is rotation of the spine. A Phelan sign. This is done by pushing the back of the hands together for 1 minute. This compresses the carpal tunnel and is also positive when it causes the same symptoms the patient feels with carpal tunnel syndrome. One common symptom of carpal tunnel syndrome is that people find shaking the hand often relieves these symptoms. Pain may extend up the arm, and the pain from carpal tunnel syndrome is often worse at night. Often patients find they are awakened at night and have to shake out their hand to get the tingling in their fingers to resolve. Other activities, including driving and typing, can aggravate symptoms of carpal tunnel syndrome. The two most common tests are called Tennell's and the Phelan test. Now, the Tennell's test is performed by tapping the median nerve along its course in the wrist. A positive test is found when this causes worsening of the tingling in the fingers when the nerve is tapped. Now, the bold sign indicates fluid with the knee joint and can detect small amounts of fluid, but can be absent if large amounts of fluid is present as the joint is extremely distended. To check for a bold sign, milk fluid upward with the ball of the hand at the medial aspect of the knee to displace the fluid upward. Press or tap the knee below the large margin of the patella. Look for returning fluid in the hollow medial of the patella. Ballotman checks for a floating patella by eliciting a palpable tap that indicates fluid within the knee joint. Grasp the thigh just above the knee with one hand. Force fluid out of the superior portion of the joint space into the space between the patella and the finger. With the fingers of the hand, push the patella sharply back against the femur. Ballotment of the patella assists the nurse in detecting an effusion. A meniscal injury is evaluated by checking for McMurray sign. Flex a knee with the person in supine position with the foot near the buttocks. Place hand on the knee so that the thumb and index finger lie on either side of the joint space. With the other hand, grasp the heel and use both hands and forearm to rotate the foot and lower leg laterally. While maintaining the rotation, extend knee to the right angle. Feel and listen for a click. A palpable or audible click suggests a torn meniscus. Thomas test for hip contracture. The patient is supine with the pelvis level and squared to the trunk. Stabilize the pelvis by placing the hand under the patient's lumbar spine. Have the patient flex both hips, bringing the thighs up to the trunk. Have the patient hold one leg to the chest and let the other leg down until it is flat on the table. If the thigh rises off the table, the test is positive for a hip flexion contracture. This test does not differentiate between tightness of the iliopsoas versus the rectus femoris.